Hello and welcome to McLaren Port Huron's Today's Health. I'm your host, Barb Winters. Did you know that sometimes leg pain is caused by peripheral artery disease? Joining us for this important discussion is board-certified cardiologist, Dr. Elias Skaf. Dr. Skaf, welcome back to Today's Health.
Thanks for having me, Barb.
Let's start with a definition of peripheral artery disease.
That's a good question to start with. Peripheral arterial disease, or what I would call it from now on, then it's PAD, is a vascular arterial disease cause blockages in the arteries outside the heart, and that can affect the arteries of the legs, the arteries of the arms, the neck, we call them carotid arteries, or the arteries of the intestine and the abdomen, we call them mesenteric arteries. So any artery affects outside the coronary arteries or the arteries of the heart, we call that PAD, or peripheral arterial disease.
Can you just review for us a little bit the circulatory system?
Definitely. Can I use the graphic here?
Absolutely.
Okay. So I want to start here from the heart. The heart gives major large artery, we call that the aorta, comes all the way down in the chest and then in the abdomen. In the pelvis, the aorta bifurcate into two major branches, we call them the iliac arteries. Each branch go to one leg down all the way to the feet. Now, beside that, of course, the aorta gives two major branches to each arm. We call them subclavian arteries, and that's pretty much the circulatory system.
So are all of those arteries you talked about, except the ones in the heart, peripheral arteries?
Definitely. So any blockages affect the arteries outside the heart, like the carotid artery, we call that carotid disease. That's part of peripheral arterial disease. It could affect the arms as well, mesenteric arteries in the abdomen and pelvis, and of course in the lower extremities.
So as you're telling me this, I'm thinking, wow, peripheral artery disease could be a serious condition.
Definitely. Peripheral arterial disease is a serious condition. It affects about 10 million Americans. It's absolutely a very serious disease, and we will, for multiple reasons, including the discomfort and pain which affect the organ. We'll talk about that later, of course.
Dr. Skaf, what causes PAD?
PAD, Barb, caused by the buildup of fatty material and cholesterol in the wall of the arteries. Once that plaque builds inside the artery, it will narrow the lumen of the artery and prevent enough blood flow going down to the organ or the tissues. If I can use a graphic to point what I'm talking about, this is a normal artery. You can see the lumen is wide, the wall of the artery is thin and nice. There is no plaque inside the artery, there is no fatty material inside the arteries. Now, this is an artery affected by peripheral arterial disease, where you can see the fatty material and plaque building inside the wall of the artery, causing that lumen to be very narrow, and of course not providing enough blood flow down to the organ or tissue related to this artery.
So is it the same problem as we think of when we think about coronary artery disease? It's the same problem in all of the other vessels?
Definitely.
In the body? And what organs then does it usually impact?
Any organ outside the heart can be affected by peripheral arterial disease. It could be the lower extremities, which is actually the case in the majority of the time. Could be the upper extremities. Could be the arteries of the intestine, we call them mesenteric arteries. And could be, of course, the arteries of the brain, we call them the carotid arteries. So any artery outside the heart is prone to be affected by PAD.
What are the risk factors for PAD?
Risk factors for PAD. PAD has multiple risk factors. The risk factors include, number one, smoking is very, very important risk factors. Diabetes, especially uncontrolled diabetes, uncontrolled high blood pressure, uncontrolled cholesterol in the blood as well. Of course, there is other risk factors including related to diet and exercise as well. The consuming unhealthy diet, lack of exercise, this is all will cause peripheral arterial disease.
So as you're telling me this, I'm thinking some of the same things that are causing our coronary artery disease are causing our peripheral artery disease.
Definitely the same risk factors of coronary artery disease. I just want to go back to the graphic here, Barb, and point about the cause of peripheral arterial disease. As we mentioned earlier, it's a buildup of a black or fatty material and cholesterol inside the wall of the arteries. This is how the artery, this is an artery affected by BAD. You can see the black inside the artery causing the narrowing in the artery. This is whatever left from the lumen of the artery. That's not how the normal artery looks like.
So you can see if that's happening, then you can see why it impacts the organs that it feeds.
Definitely.
Because it's not getting the blood that
Definitely.
it needs.
Definitely.
Well, I'm looking forward to talking about those symptoms, but first we're going to take a break.
Perfect.